My name is Jared Kutzin. I'm the Director of Simulation at St. Barnabas Medical Center in Livingston, New Jersey. Our simulation lab is about 800 square feet. We are part of a hospital system and a hospital. We are primarily responsible right now for the OBGYN department, but we are expanding outside of there and working with other departments as needed. And we're physically located in a medical office complex right across the street from the medical center. So I got started in simulation probably about 7 years ago at this point. I was a grad student at Boston University taking classes for my MPH in health policy and management. And I had a wonderful faculty member who was telling us how the way we talk changes the way we work. And at the end of class one day, I said to her, I don't quite understand how this relates to a clinical person since most of my colleagues work non-clinical. And my professor says, well, why don't you come see what I'm doing outside of the university? We sometimes let grad students come take part in a class that we offer. And that was my first exposure to simulation. My faculty member was Dr. Jenny Rudolph, who works at the Center for Medical Simulation in Cambridge, Massachusetts. And from there, I saw what they were doing with medical simulation for the clinical provider. And from there, once I graduated, I started working at Brigham and Women's Hospital and got involved with the Strata Center for Medical Simulation at that institution. And then when I moved back to New York, I started working with some nursing schools, but eventually worked at the New York City Health and Hospital Corporation at their Institute for Medical Simulation and Advanced Learning, where we helped open that center. And now I find myself over in New Jersey, sort of at the grassroots level again, trying to build and develop a simulation program at my current institution. So I think it's really important that when you start a simulation program that you have both buy-in from the frontline staff, but also executive support for a simulation project. Simulation is an endeavor that needs support from multiple levels of the institution, both financial support, but also support for dedicated time for employees and the educational technique of using simulation. So I think that it's important that you think of using simulation in multiple modalities. We're looking at using simulation, or we're using simulation for team training. We're using it for clinical skills training. But one of the areas that I think is really unique to what we're doing is the use of it as part of our process improvement cycle. So we're using it to test our system of response for a number of different clinical conditions in an effort to improve the quality and safety of care. And that might not necessarily be unique to our institution, but I think it's one of the future uses of simulation that has to be thought about as we continue to use it to improve the systems of care, not just the teamwork and communication techniques that we often talk about educating people in the simulation lab, but really making sure that it translates back to the clinical environment. We're trying to become integrated into the process improvement, the quality and safety agenda of the institution. I think if you're able to do that, then you stand a good chance of succeeding in implementing your program. Simulation, in my mind, can't be put on top of what you currently have in place. It has to be integrated into your current system. It has to become part of what you do. So we have identified an issue in our institution related to getting blood to the bedside of a hemorrhaging patient, and we use the process improvement techniques and strategies that are common in terms of identifying areas for improvement, but then we use simulation to test our solutions and also to confirm our flow charts and our diagrams and the other steps that we used to reach an eventual solution to these problems. I think it's a great opportunity for networking and hearing what other people are doing in the simulation community. I'm really impressed with the speakers who I've met so far. Their knowledge and command of the subject matter, but their also breadth and scope of information that they are talking about. I attended a session earlier today about the return on investment and return on engagement, and those topics are really, really valuable and really important for simulation directors, simulation administrators, simulation educators, because we need to present that sort of information to our executives to get them to buy into a program. as we've been talking about, it's not cheap to implement a simulation program, and you need to see something as an outcome. And what that is up for sort of debate, but having that discussion of return on investment versus return on experience was a great opportunity to sort of hear somebody else's perspective on it.